In the fifth and final section of our lecture, we will talk about the stapedectomy. In this section, we will talk about the different steps of stapedectomy and what are the complications that can occur after removal of the stapes. So this diagram is showing you some steps of stapedectomy. This is stapes and foot plate removed. Here you can see it's removed. Two bones are there. Oval window is exposed. This is the oval window. It's exposed and stapes is removed already. And in this diagram you can see the stapes is replaced by the prosthesis here, wire fat prosthesis in place. So that's how the prosthesis is inserted, and it holds the handle of this is the incus. So handle of the incus. And this is the prosthesis. This is the actual picture showing the surgery, and this is the well of the bucket prosthesis. This is the prosthesis, and this is the handle attaching to the process of the incus. Here, this is the incus process, and it holds the incus process like it is the stapes is attached to the incus. So that's the prosthesis. Now these are the steps of stapedectomy. In this, the incision is given, which is about 5 to 7 millimeter incision or surgical cut is performed. And then in the next step, the tympanomeatal flap raised and reflected forward. Posterior superior bony overhang to be removed, dotted line. So in this, the incision is given, and then the flap is raised, reflected back forward like this here, and you can see it's reflected. And then we can see the ossicles and then different structures. After the flap is removed, now you can see chorda tympani, we can see the facial canal, and then stapedial tendon. This is the stapedial tendon, and then we have the other bones attached to this here. Then in next step, stapedial tendon cut and stapes superstructure removed. After the tendon, this is the tendon that's holding the stapes. Once it is cut, then the stapes is removed. After this is the structure removed. This is the round window, and then small fenestration made in the foot plate and Teflon piston inserted. So after that, the piston is inserted instead of the stapes. So just incision and then removal of the flap. After the flap is removed, then you can see the ossicles and the stapedial tendon. Tendon is cut, and then it caused the free the stapes that is removed, and instead of the stapes, now the prosthesis is inserted, and that prosthesis attached to the incus here, process of the incus. The complications of stapedectomy. Once the stapes is removed, what are the complications that can affect the patient? There is tear of tympanomeatal flap and perforation of tympanic membrane. There is a very, make sure you should know that middle ear, inner ear, and tympanic membrane, they are very, very close here, closely connected to one another. So whenever the surgery is performed on some area, there are chances of injury or damage to the other structures that are present nearby. So here, this is the stapes, this is the eardrum. So perforation of eardrum can occur, or perforation of tympanic membrane can occur. Injury to chorda tympani, we saw in the previous diagram that the chorda tympani are present very close, so it can be damaged. Incus dislocation, which is another bone here, incus, since the prosthesis which is inserted, it holds on to the incus process. So incus dislocation is very likely because of pressure on the incus. Injury to facial nerve, conductive loss, sensory neural hearing loss, intraoperative trauma can lead to sensory hearing loss, and then labyrinthitis, inflammation or infection of the inner ear, because when the surgery is performed, it can lead to infection. Fistulas. Fistulas are the connection between two structures. So if there is injury, it can later on lead to formation of fistulas and drainage of the fluid, perilimb fluid. Granulomas are formed due to healing or old surgeries. Vertigo is present early, in the time after the surgery, and then late is usually present due to fistula formation. So if the fistula is formed during the surgery, it can lead to vertigo also due to drainage of the fluid, and also it can cause benign positional vertigo. If patient sit after standing and stand after sitting, it can have dizziness or vertigo. Perilimb fistula and granuloma, and then there is also conductive loss, short prosthesis, loose prosthesis, and displacement of prosthesis. If prosthesis is displaced or if it becomes loose, it can cause conductive deafness, because now it is causing obstruction to the movement of the sound waves. So all these are the complications that can occur in patient with stapedectomy: hearing losses, fistula formations, labyrinthitis, perforation of tympanic membrane, and then vertigo or dizziness. And then sometimes dead ear, no hearing at all, nothing. So that's the dead ear. So many complications of stapedectomy. Then some other treatment options for otosclerosis. If stapedectomy is not recommended, then there may be just the mobilization of the stapes by removing otosclerotic portion. And then other is fenestration operation can be performed, and then hearing aid is also an option if patient has a hearing problem. So all these are another treatment option for otosclerosis, because stapedectomy is the most common procedure performed to treat the patient with otosclerosis. But we already saw so many complications can occur. So if it can be avoided, should be avoided. If patient can get better with other treatment options, we should go for those options. So that was all about our lecture topic, otosclerosis. So thank you for watching sqadia.com.